back with another Reddit story, and this one is from the subreddit called Ask Docs. So people come on here for like a little bit of medical advice. For those of you that don't know, I am a medical doctor. I went to medical school. I graduated in 2020. I passed my US medical licensing exams, step 1 and 2. And then I decided I was not willing to stay in the US to do residency for whatever reasons. Anyhow, that's just my background. I just take it with a grain of salt that while I am a doctor, I am not a practicing physician, and this is not medical advice. This person says, I contracted an STD in a seemingly monogamous relationship. Is there a way to explain this without my partner cheating? It depends what it is. Things like HPV can be dormant for years and you can never have a problem and they can suddenly show up. Herpes can do this. There are certain things where it is possible. It says, hi, I, a 38-year-old female, have been in a monogamous relationship for the last 11 years. And every couple years during my women's health appointment, I get screened for STDs because you always hear stories about cheating, dirty needles, crazy dentists, etc. I mean, I personally get tested every 6 months. The guidelines do suggest doing an STD test every 6 months, regardless of whether or not you are active. And I do think that every couple years is honestly just far too long to wait. And you are seriously putting your health at risk and in jeopardy by doing that. If you have gonorrhea or chlamydia, you can have pelvic inflammatory disease. You can affect your fertility, especially for women. I think you should be really careful. And I really, really recommend everyone getting tested every 6 months for everything, including HIV. I didn't think anything would come back positive, but lo and behold, this morning my doctor informs me that I have gonorrhea. That's not one of the ones that hides for 11 years. This was diagnosed through a urine test. I have had some itching in the past 5 months that I assumed was due to hemorrhoids, but now I am not sure. My husband and I are not active in that way. I know that I have never cheated, and I really thought the same of my husband. Well, there's two of you in this relationship, and if you're not cheating, he is, because gonorrhea is not one of these big boys that likes to hide for years and years. I have been tested for gonorrhea multiple times in my relationship, although it seems like the last test that I can find was in 2021. The fact that you had a negative test and it's gonorrhea and you've had symptoms for a few months all suggest that this is a new infection. I'm really sorry, but yeah. When I was in medical school, we actually did see this a lot. Like a big part of my OBGYN rotation was testing pregnant women for these infections and then telling them, often with their partner in the room, that their partner has been cheating if they haven't. And many times the patients would break down crying, they would be upset. It was really hard to watch, and especially when they're in just such a vulnerable position, pregnancy is so dangerous, and their partners are running around giving them infections that can change their lives and the life of the fetus and be life threatening. It was hard to watch, and honestly, like, I'm so sorry. But yeah, if it was negative in 2021 and it's positive now, girl, you got a husband problem. Anyhow, this test back in 2021 was a cervical swab and it was negative. So when I tell my husband tonight, I will ask him when he was last tested because I thought we both were when we first got together, but now I'm unsure. This is really unfortunate, so sorry. OP continues and said, is it possible that either my husband or I have had asymptomatic gonorrhea this whole time? Does this exist, or am I being naive? Well, I don't think you're being naive. I think you're open to the possibility. I think what you are is in denial. And you have hope. And you hope that the person that you love and trust and share your life with for over a decade has your best interests at heart. And if they are going to sleep around, why wouldn't they use protection? Like, we do see false positives sometimes. It is possible. I hope for your sake that's the case. And yeah, there's no update here, but I hope it worked out for the best and good luck.